Welcome to the 2022 Open Enrollment presentation for UC San Diego retirees. My name is Deborah Wells, and I'm the Healthcare Facilitator for UC San Diego. I will be highlighting some of the plan changes for next year. Our open enrollment mailings were delayed a little this year, but you should all have your booklet by now. The university pulled the mailing addresses information on September 30th of this year. If you moved or changed your address after this date, you will need to log on to UCNet to view the booklet online. The first booklet on the far left was mailed to UC San Diego actively working faculty and staff. The booklet in the middle was mailed to UC San Diego retirees living in California and retirees living outside of California if you have a family member that is not eligible for Medicare. The booklet on the far right was mailed to UC San Diego retirees living in a state outside of California, and all family members are enrolled in Medicare. As a retiree, your booklet has a special number printed above your name. This number signifies or indicates the maximum amount UC will contribute towards your medical and dental premium. If you have a 100 listed above your name, the premiums listed in the booklet apply to you. If you have any number less than 100, the premiums listed do not apply to you, and you will need to log into UC Raise to find the premium for next year. Your medical plan premiums are listed in your open enrollment booklet, starting on page 6. Again, the premiums listed are for retirees eligible for 100% of the maximum UC contribution. Many retirees want to know if they are eligible for the Medicare Part B premium reimbursement. A retiree is eligible for the Medicare Part B reimbursement if their premium is 0. Open enrollment is the time to consider your options for next year. Are you satisfied with your current medical and dental plan options? Have you recently married or need to add or remove a family member? Are you aging into Medicare next year? Have your health care needs changed, or do you need more flexibility? If you previously suspended your health plans, do you need to unsuspend your health plans? This is the time to make those changes. If you decide to change plans, it's important for you to know that there are no pre-existing conditions exclusions. Please note that there is a new deadline this year. If you need to make an open enrollment change, they must be completed by November 19th at 5:00 p.m. Pacific Standard Time. Open enrollment began on October 28th and will end on November 19th for the University of California. Medicare's open enrollment began on October 15th and will end on December 7th. Please do not get these two deadlines confused. You need to make sure that you abide by the university's open enrollment deadline. If you are on recall or a rehired retiree and you have UC's retiree health coverage, you will receive a Medicare survey. You could possibly receive a Medicare survey. Please complete the survey and return the survey as instructed. When the form asks if you're working, the answer is yes. When the form asks if you are covered under a group plan through your employer, the answer is no. If Medicare is not reflecting as primary, make sure you call Medicare Coordination of Benefits Office at area code 855-798-2627 and provide your retirement date. What happens if you do nothing? If you are satisfied with your current health plans and do not make any open enrollment changes, your current plan selections will automatically continue for next year. If you happen to log in to view your health plan options and view your premiums, and it gives you a notice to confirm your selections, but you haven't made any changes and you don't want to make any changes, you can simply just back out of the system or go ahead and select confirm. There are many tools you can use to help with your open enrollment selections. To get started, log into ucal.us/OE. Then click on Get Started. Once you're there, click on Retirees. There is also the Medical Plans tab. Click here to find plan changes, compare plans, and plan premiums for next year. When you are ready to make your changes, click on UC Raise. If you have a form to complete, you can also upload your forms into the UC Raise account. Once you're logged in, click on Open Enrollment. If you need to add a family member, click on this tab. If you need to add a family member. To find out what your premium will be for next year, click on this tab. Retirees having any problems logging into UC Raise or are locked out of the UC Raise portal, you can call RASC at 1-800-888-8267 to make changes over the phone. You can also complete the UBEN 100 form to make your changes. If you have Medicare, you will need to complete the Medicare form according to the plan you will select for next year. If you're enrolling in an Anthem Blue Cross administered plan, complete the Medicare's UBEN 123 form. If you're enrolling in Kaiser Senior Advantage, complete the UBEN 127 prescription drug form. If you're enrolling in UC Medicare Choice PPO, complete the UBEN 121 prescription drug form. If you will be disenrolling a family member or suspending your UC's Medicare plan, you need to also complete the UBEN 101 form. Make sure you fax your forms to RASC at 1-800-792-5178. That must be received by the deadline. If you're mailing your forms, mail them to PO Box 24570, Oakland, California, 94623. It must be postmarked by the deadline. There are no changes to the medical vendors and plan offerings for next year. For our non-Medicare plans, we have the PPO plans administered by Anthem Blue Cross, which are UC Care, Core, and the UC Health Savings Plan. We have an HMO plan administered by HealthNet, which is UC Blue and Gold. And we have Kaiser Permanente, which is also an HMO. We have 3 Medicare supplement plans administered by Anthem Blue Cross. Those plans are UC Medicare PPO, UC Medicare PPO without prescription drugs, and UC High Option. For Medicare retirees within California, we have 2 Medicare Advantage products, Kaiser Senior Advantage and UC Medicare Choice, administered by United Healthcare. UC continues to offer a Medicare coordinator program through VIA Benefits for Medicare retirees residing outside of California. On the far right are the non-medical plan options for next year. Depending on where you live will determine your options for next year. Plans listed in black print are the non-Medicare plans. Plans listed in red print are your Medicare plans. If you are a retiree living in the state of California, these are the plan options here. Outside of California, these are your plan options. If you are a retiree living abroad, there are only 2 medical plan options, which are UC Care and Core. If you notice, there are no Medicare plans listed, and that's because Medicare does not pay for services abroad. Medicare fact sheet. The Medicare fact sheet can be found on UCNet. This booklet will cover Medicare and what UC requires of you when you become eligible for Medicare. Retirees and family members enrolled in a UC-sponsored medical plan who become eligible for premium-free Medicare Part A must enroll in Medicare Part B. UC relies on Medicare to offset the cost of medical insurance. Failure to comply may result in penalties and permanent loss of UC-sponsored medical coverage. You want to make sure you start the Medicare application process 3 months before your 65th birthday. There are 2 exceptions, and that's for those who retired prior to July 1st, 1991, or retirees who reside outside of the United States. But please keep in mind, if you return to the United States and update your address with the university, you will be required to enroll in Medicare at that time. It's possible that you could be subject to penalties. That penalty is assessed by Social Security, not the university. If you're aging into Medicare next year, you want to make sure that you're looking at what your Medicare plan options will be for next year. If you have some family members that will be not eligible for Medicare and some family members eligible for Medicare, you want to make sure that if you're in the UC Blue and Gold plan, you know that your Medicare family members will be in the UC Medicare Choice PPO plan. If you are in the Kaiser Permanente plan, your Medicare family members will be in Kaiser Senior Advantage. If you are in CORE or UC Care, your Medicare family members will be in UC Medicare PPO. If you're a retiree enrolled in a UC Health Savings Plan, there is no Medicare coordinating plan. So you must select one of the plans above, and your Medicare family members will be in the Medicare equivalent plan. UC Blue and Gold plan changes for next year. We have flu shots for adults and children. They can now be obtained at the office or a Health Net contracted pharmacy with a zero copay. Adult immunizations can be obtained at the office or Health Net contracted pharmacy for a zero copay. The immunizations for a zero copay do not apply to the children's vaccines. Brand drugs and generic equivalents will require prior authorization. Let's go over Medicare and UC Blue and Gold. If you're thinking of enrolling in the UC Blue and Gold plan, it is administered again by Health Net. The inpatient copay is $250, outpatient surgery $100. The emergency room copay is $125. I have the prescription drug copays listed here. $5 for generic, $25 for brand, and $40 for non-formulary. The physician office visit is $20. Behavioral health visits are $20, and the provider is Managed Health Network, also known as MHN. Hearing aid allowance, you receive a 50% allowance up to $2,000 per ear every 36 months. Acupuncture and chiropractic care is $20 for a maximum of 24 visits, and this is a combined benefit per year. Telehealth services, virtual visits or behavioral health virtual visits are $20, and it's through Babylon, available 24/7. Other services that Health Net Blue and Gold offer are 24/7 Nurse Line, My Strength, Health Coach, Omada Health Weight Loss Program for those with diabetes or heart risk. If you're in the UC Blue and Gold plan, it is an HMO plan, so you have to pick a primary medical group, a primary care physician, and you need to have services within that group. The annual out-of-pocket maximum is $1,000 individual or $3,000 for a family of 3 or more. These out-of-pocket maximums are for medical, behavioral, and prescription out-of-pocket expenses. If you have family members that will be aging into Medicare, the Medicare coordinating plan is United Healthcare. So as family members age into Medicare, you will switch over to UC Medicare Choice. It is a PPO plan and administered again by United Healthcare. If you notice, many of the copays are the same. There is a reduction in the emergency room copay, and it's $65 once you switch over to United Healthcare. The prescription drug copays are the same. The physician office visit is the same. Behavioral health copay is $20 the same, but it's administered by United Healthcare. The hearing aid allowance is a $2,000 combined ear every 36 months. Acupuncture and chiropractic services, $20 for 24 visits, but it's not a combined visit like with the UC Blue and Gold. You have 24 visits each benefit, 24 visits for chiropractic care, 24 visits for acupuncture. Telehealth services will continue, $0 copay for doctor visits or a $20 copay for behavioral health visits. You will continue to be able to access Amwell and Doctors on Demand. New this year is Teladoc. Silver Sneakers for United Healthcare, UC Medicare Choice members is going away. You will no longer have access to Silver Sneakers, but it will be replaced by Renew Active, which has an expanded gym network. Hopefully, none of you will experience a disruption in your gym membership. With the UC Medicare PPO plan, because it is a PPO plan, it has open access. You may see any Medicare provider as long as they bill your United Healthcare plan. So with the HMO plan, you had to select a medical group and stay within that medical group, where with the UC Medicare Choice, it's open. So you can bounce back and forth between different medical groups and providers. You can see a UCSD provider today, you can see a Sharp provider the next day, you can see Scripps physicians the following month, or even access services out of state. You also have access to care while traveling abroad. The annual out-of-pocket maximum is $1,500 each, or $3,000 for a family. The prescription out-of-pocket maximum is $2,000. The true out-of-pocket maximum for next year is $7,050. Now we'll go over Medicare and Kaiser Permanente. Some of the Kaiser plan changes for next year are the dental exams and treatment. It's actually retroactive change to January 1st of 2021. Medically necessary dental exams and treatment prior to any organ transplant is now covered, where it was previously covered only for kidney transplants. House calls, cost share will align with the service that's being rendered. So if you have an in-home medical visit from your primary care physician or a specialist, it is currently a $0 copay. But next year, it will align, the copay will align with whatever service you are having rendered. You must, of course, use Kaiser providers and Kaiser facilities. The only exception are for urgent care services and emergency care services. You have same-day telephone and video appointments available at kp.org/getcare or call 1-833-574-2273, available 24/7. They also have a pre-enrollment toll-free hotline. You can call 1-800-324-9208 to ask your pre-enrollment questions of their Kaiser member services. Additional benefits and offerings are listed here. You have access to target clinics. Just call 1-833-KP for care. Also, away from home, travel services and visiting member program. Call 1-951-268-3900. They're available 24/7. And that's when you're traveling or outside of your Kaiser Permanente service area. You also have CVS Minute Clinics in states without Kaiser urgent care needs. It's available 7 days a week. Some of the hours may vary. Wellness apps and health and fitness discounts are also available for Kaiser members. If you're thinking of enrolling in a Kaiser plan for next year, the copays are listed here and there are no copay changes. The inpatient copay is $250, emergency $125. The prescription copay is $5 for generic, $25 for brand, and mail order, $5 for generic, $25 for brand. Eyeglasses are not covered under Kaiser Permanente. Behavioral health services, you have two benefits. You have Kaiser Behavioral Health and you have Optum Behavioral Health. Wellness resources, you have the Calm, which is a free app on your phone. My Strength, also a free app. You have Class Pass, which is also free and gives you access to over 4,000 plus gyms. And you have the Choose Healthy discounts. Hearing aids, you have a $1,000 allowance per aid per ear. Acupuncture and chiropractic care is $15 for a copay, and you have 24 visits per year. And this is a combined benefit. So 24 visits combined between acupuncture and chiropractic care. Your out-of-pocket maximum is $1,500 individual or $3,000 for two people or more. And these out-of-pocket maximums include medical, behavioral health, and prescription copays. You also have access to Target clinics, no authorization necessary, a $0 copay for preventive, and $20 copay for non-emergency services. As family members age into Medicare, you'll switch over to Kaiser Senior Advantage and need to complete the UBIN 127 form. The copays for some services are the same. Emergency room copay is reduced to $65. Prescription drug copays are the same. The eyeglass benefit, where it was once not a covered benefit, you actually have a $150 allowance for eyeglass lenses, contact lenses, and frames every 24 months. Under the Kaiser Senior Advantage, the Optum behavioral health benefit goes away. You have no Optum coverage, but you do continue to have Kaiser behavioral health coverage. You have the same wellness resource apps. The hearing aid allowance actually is increased to $2,500 allowance per ear. You still have acupuncture and chiropractic benefits. The copay is $20. The annual out-of-pocket maximum is $1,500 each or $3,000 for family, and that's for medical only. Your prescription out-of-pocket maximum has a separate out-of-pocket maximum, and it's $7,050 for next year. Along with the Kaiser Permanente members, Kaiser Senior Advantage also has access to Target clinics with a $0 copay for preventive and $20 copay for non-emergency services. Now we'll cover the Anthem PPO plans. Our Anthem Blue Cross PPO administers 6 of our plans. They administer the UC Care, UC Health Savings Plan, Core, our Medicare PPO without prescription drug plan, and High Option Supplement to Medicare. The UC PPO plan changes for next year. The biggest change is the prescription pharmacy benefit manager. Navidis replaces Anthem Ingenio RX as the pharmacy benefit manager for next year. So if you are enrolled or are thinking of enrolling in UC Care, the Health Savings Plan, Core, Medicare PPO, or High Option Supplement, your pharmacy benefit will be changing. The retail pharmacies, including participating UC pharmacies, will be available. The mail order will go through Costco. Specialty drugs will go through Lumicera and participating UC specialty pharmacies. There could possibly be a new formulary, and you may have to go through the pre-authorization process for some of your medications. Just keep that in mind. It's a good opportunity for you to review the drug formulary now before the next year, if you're in one of these plans, to make sure there's no disruption in your current medications. The other addition or change for next year is Learn to Live. Learn to Live replaces My Strength app. It's a new platform, includes one-on-one coaching and peer support by opportunity to include family or current therapists in program. Anthem letter was sent out to those in My Strength or currently using My Strength. Again, Navidis is the new prescription drug vendor for next year. And to get to the Navidis pre-enrollment website, all you have to do is click on this website here. By clicking here, you'll be able to look up the drugs that you're currently on, look for pharmacies, and look at the cost for your medications. They're available 24/7 through their customer care. If you're in one of the non-Medicare plans, you would need to call Navidis customer care at 855-673-6504. If you're in one of the Medicare PPO plans or high option, you would need to call customer care at area code 866-270-3877. The member portals will be open January 1st, 2022. We'll now go over our PPO plans. If you're thinking of enrolling or currently enrolled in UC Care, you know that it has 3 tiers. You have UC Select, in-network, and out-of-network. The UC Select copays and benefits will apply when you're using UC providers, UC San Diego, UCLA, any UC provider. The in-network benefits will apply when you are using a contracted provider, meaning they're contracted with Anthem Blue Cross. But if you are not using a UC provider and you're not using a contracted provider, you will be considered out of network, and these benefits will apply. Again, the biggest change for next year is Navidis. Costco will be the mail order vendor for next year for UC Care. One thing I want to point out is under the UC Select tier, you want to make sure that you review the evidence of coverage booklet for any limitations or exclusions and services that are not available in the UC Select tier. It's a possibility that they might be in the in-network tier. And also, please note that multiple co-payments can apply per service. There are no new benefit or copay changes for the UC Care plan. This is a plan that offers worldwide coverage. If you are currently a retiree enrolled in the UC Health Savings Plan, this is a high deductible PPO plan, and you cannot have any parts of Medicare. Coverage within the United States or outside of the United States is covered for urgent or emergency room services only. So what's changing for next year? The maximum health savings account contributions are changing for next year. The individual increase is going from $3,600 to $3,650. The family increases from $7,200 to $7,300. If you're age 55 or older, you have an additional $1,000 catch-up for members for next year. The same one-time UC contribution towards your health savings plan will continue or will apply for January 1st. So if you are in this plan, you will continue to receive $500 if you're in self-only coverage for next year, and $1,000 if you have a family of 2 or more. If you're aging into Medicare for next year, you want to make sure that you immediately contact RASC and enroll in another plan. You cannot have any parts of Medicare if you're in the UC Health Savings Plan. The UC Health Savings Plan is not open for new enrollment. You have to have already had this plan as an employee and carried it into retirement. And I want to point out that this should say your HSA. And this is a typo, and I apologize for that. So the same one-time UC contribution towards the Health Savings Plan members' health savings account will be placed in your health savings account on January 1st. The next plan I will cover is CORE. CORE is our other worldwide coverage plan. If you're in the CORE plan, it has a 0 premium. It has in-network and out-of-network benefits. The in-network and out-of-network deductible is $3,000. Preventive services are covered with a 0 copay. After you meet your $3,000 deductible, the coinsurance applies here. The plan pays 80% and you pay 20%. If you go out of network, the plan pays 80% or the usual and customary benefit, and you will pay the 20% or any remaining balance. The prescription drug vendor, again, is switching over to Navidis. Telehealth or telemedicine is available through Live Health Online, available 24/7 for doctor or psychiatrist visits at a $49 copay. Hearing aids are not covered under this plan. The out-of-pocket maximums are listed here. For CORE, there are no copay or coinsurance changes for next year. If you are in the UC Care Plan or CORE Plan and you have family members or you're aging into Medicare, your Medicare coordinating plan is UC Medicare PPO. Medicare is your primary plan. Anthem Blue Cross will be your supplement plan. Your deductible is $100. You have a 0 deductible if you use Medicare approved providers. Your inpatient copay or coinsurance is no copay for days 1 through 60. Days 61 through 90, you pay $70.40 per day. Days 91 or more, you pay 20% of that inpatient stay. For physician, behavioral health, or chiropractic visits, you pay 20% coinsurance. If you use a non-Medicare provider or a non-contracted provider, you would pay 20% and any remaining balance. The copays are listed here for UC Medicare PPO. The changes for next year for this plan are the mail order vendor is Costco, and again, Navidis is the pharmacy benefit manager for next year. There are no eyeglass coverage for this plan. If you're thinking of enrolling or will be enrolling in this plan, you may want to consider enrolling in VSP. The hearing aid and acupuncture services are not covered by Medicare, but Anthem, your supplement plan, will cover it at 80% and you pay 20%. The annual out-of-pocket maximum is $1,500 for medical services. The prescription out-of-pocket maximum is $7,050. Telehealth, telemedicine services go through Live Health Online, available 24/7 with the $20 copay. This plan offers worldwide coverage up to 6 months. If you find yourself visiting abroad or living abroad over 6 months, you must enroll in UC Care or CORE. Please note that you must use Medicare approved providers. There are some exceptions, and those exceptions are acupuncture services, hearing aids, and behavioral health outpatient office visits with all licensed providers, including psychiatrists, psychologists, and marriage and family therapists. Please make sure you understand how your plan works and review the evidence of coverage booklet. It's ultimately your responsibility to know how your plan works. And the reason I mention that is because many providers will say that they have opted out of Medicare. Many of the psychiatrists and psychologists and marriage and family therapists, they've opted out of Medicare and they will have you pay cash up front. So it's your responsibility to know how your plan works so you can tell your provider that although you've opted out of Medicare, you do have coverage through your supplement plan. Now we will cover UC high option. Medicare is primary, Anthem Blue Cross is secondary. Many of our retirees like the UC high option plan, even though it's our most expensive plan, because many of the services are covered at 100%. It does have the lowest deductible of $50 per year. Most services, again, are paid in full at 100%. Your inpatient services, days 1 through 90, are no copay. Days 91 or more, you have a 20% copay. Physician, emergency room visits, chiropractic visits, no copay. Behavioral health, mental health services, again, you pay nothing for these services unless you use a non-Medicare provider. And in that case, you would pay 20%. The prescription copays are listed here. The mail order vendor is changing to Costco. The pharmacy benefit, again, is switching to Navidis. The high option plan does not have any coverage for eyeglasses. High option members should consider enrolling in VSP. Hearing aids and acupuncture are not covered by Medicare, but your supplement plan, Anthem Blue Cross, will cover at 80%, you pay 20%. The annual out-of-pocket maximum is listed here, $1,050 for medical services and $1,000 for prescription out-of-pocket maximum for next year. The true out-of-pocket maximum is $7,050. Most UC high option members will never reach this out-of-pocket maximum because our copays are very low. Telehealth services are through Live Health Online, available 24/7 for doctor and psychiatrist visits with a $20 copay. This plan also offers worldwide coverage up to 6 months. If you find yourself vacationing or living abroad over 6 months, you must contact RASC and enroll in UC Care or CORE. Again, you must use Medicare approved providers, and the exceptions are listed here. As a UCSD employee, I take pride in sharing that we were ranked the #1 health system in San Diego by US News and World Report. During open enrollment, if you would like to have access to UC San Diego Health by enrolling in UC Blue and Gold, UC Care, CORE, the UC Health Savings Plan, or our Medicare plans, which are UC Medicare PPO, UC Medicare PPO without direct coverage, UC High Option, or UC Medicare Choice PPO, all of these plans will give you access to UC San Diego Health, primary care, and specialty care services. All you have to do is call the 1-800-926-8273 to find a provider available for you. UC San Diego Health offers more choices and better options across San Diego County. It's a broader network for our employees and retirees and their family members. Now we'll cover VIA benefits. Since 2014, UC began offering retirees who live in a state outside of California their medical plan coverage through UC's Medicare Exchange program. Remember, all family members must be enrolled in Medicare. The VIA Benefits program offers you more choices, value, and flexibility and support in the state that you reside in. UC will provide an annual contribution for each of your covered family members under a health reimbursement account. Each covered family member will choose their own individual plan that's best for them. If you're a retiree living in the state of California, you know that you, as the retiree, select the plan, and all of your family members have to be in that same exact plan or the Medicare coordinating plan. But under VIA Benefits, when you're living in a state outside of California, each family member chooses their own individual plan. So you could be in an Anthem administered plan, and your family member could be in a Kaiser plan if it's available in their state. The health reimbursement account is based on your years of service. So if you worked 20 or more years and earned 20 years of UCRP service credit, you will receive $3,000 in your health reimbursement account. Your family members will also receive $3,000 in their health reimbursement account. You use your health reimbursement funds to pay for your Medicare supplement plan, your Medicare prescription drug plan. You can reimburse yourself for Medicare Part B and Part D premiums, as well as some additional out-of-pocket expenses like prescription copays or office visit copays. During open enrollment, the open enrollment portal is locked for VIA Benefits members, and that's because it's forcing you to enroll through VIA Benefits. If you need to add family members or make changes to your dental, vision, or legal plan, you must submit a paper form, UBIN 100. Now let's go over the non-medical plans. Our dental plans for next year will continue to be administered by Delta Dental PPO. There are no benefit changes for next year for Delta Dental PPO, nor Delta Care USA, which is our HMO dental plan. UC continues to pay the full cost for retirees eligible for the full UC contribution. Retirees with graduated eligibility will pay a portion of their dental premium. Remember to look at this number. If you have a 100, you pay a 0 premium. Anything less than 100, you will have a portion to pay. For our vision plan, VSP continues as the vendor for next year. The benefit enhancements are the primary eye care program for diagnosis and treatment of some medical eye care services, including eye injury, trauma, foreign body removal, diagnosis and treatment of eye conditions, including pink eye, vision loss and cataracts, a $20 copay for most diagnostic services, and a $0 copay for retinal screening for people with diabetes. Contact VSP for more information. Retirees' rates remain the same, and they continue to pay the full 100% premium for next year. UC does not contribute towards the premium for any retiree for vision premiums. So it does not matter how many years you worked, every retiree pay the same premium. If you are currently enrolled in VSP, your coverage will continue for next year. You don't need to do anything to continue that coverage. If you need to enroll for next year, you have two options to enroll. You can enroll online at www.vsp.com/go/UC retirees, or by calling 1-866-240-8344. I've listed the premiums for next year in the upper right-hand corner. I'd like to also mention, as a VSP member, UC San Diego Shiley Eye Institute does accept our VSP plan. For our legal plan, AROG will continue as a provider for next year. The benefit enhancements are alimony and child support modifications, child support enforcement, annual accounting for guardianship and conservatorship, restraining orders, general support hours increasing from 4 hours to 6 hours per year next year. There are no rate changes, premium changes for next year. I've listed the premiums in the upper right-hand corner. For accidental death and dismemberment, AD&D, Prudential Life continues as our AD&D insurance provider. There are no changes in premiums and no benefit changes. To enroll, call 1-800-524-0542 or log on to UCNet to download their form. Accidental death and dismemberment is always open throughout the entire year for enrollment. Our pet insurance will continue to be administered by Nationwide. This is an exclusive plan with preferred pricing just for UC. It covers cats, dogs, birds, small mammals, and exotic pets. Livestock is excluded, including horses. The rates are based on the species and animal and state of residence. No UC contribution. The retiree pays 100% of the premium. To enroll, log on to www.petinsurance.com/UC or call 877-738-7874. Member ID cards. You may not think about your health insurance ID card until you or your doctor or your provider ask you for your information. It's important that you have the appropriate ID card presented for services. Every year, you should make it a point to find out if your plan will be issuing new ID cards. Over the years, I have found that many retirees and employees are carrying the wrong health plan ID card or no ID card at all. You can prevent being denied services by simply presenting the most updated ID card to your provider. All ID cards should be received by the first of the year. If you do not receive your ID card, please contact the plan directly. Do not contact RASC, and you do not contact the benefits office. You contact the plan directly. Open enrollment is the time to make changes every year. But if you have a qualifying event outside of open enrollment, you can change at that time. You want to make sure that you make your changes within 31 days of the qualifying event. So if you move outside of your current plan service area, or you have an involuntary loss of coverage because you were previously covered under a working family member and they're retiring or quitting their job and you lose that coverage, that's considered involuntary loss of coverage. If you get married or need to add a new family member, those are all qualifying events to change or enroll at that time. Just make sure you do it within 31 days of the qualifying event. Before I end, I would like to tell you briefly about our healthcare facilitator program. We assist UCSD employees and retirees and your family members. We serve a large population of active and retired faculty and staff. You can find our contact information here and on UCNet. Because we serve a large population, before you contact your healthcare facilitator program, take the time to understand your benefits. Log into UCNet and review your evidence of coverage booklets or check if there are any plan limitations or exclusions to your plan. Call your medical plan directly. Many of your questions can be answered by calling your plan and checking on authorization requirements or provider networks, and they can also help you find a primary care physician. You can contact the medical plan provider's office or the billing office if you receive a bill. You always want to make sure you do that first and make sure they're billing your correct insurance. But if you've done these things and you're still having problems accessing services or getting the help that you need, please make sure you contact Ronisha or myself, and we'll be more than happy to assist you. Listed on this page are resources you may find helpful. I've included the steps retirees should use when you are ready to make your open enrollment changes. Again, you just want to log into ucal.us/OE, click on retirees, sign into UC Raise, click on open enrollment, and make your changes. Please make sure that you confirm your changes, and you may have to select or click on confirm a few times. You want to make sure that you receive a confirmation by email. If there's no email address on file, they will mail you a confirmation. I also have listed here UCNet. If you're not familiar with UCNet, you need to get familiar with this web page. Everything you need to know about the university can be found here. Annual open enrollment information, complete guides to benefits, forms and fact sheets, your evidence of coverage booklets, the Medicare fact sheet, UC retiree health eligibility rules, and many webinars. The Retirement Administration Service Center located in Oakland, I've listed their phone number and the link to get to their website. The UC San Diego Healthcare Facilitator Program, again, is myself, Deborah Wells, Healthcare Facilitator. My number is listed here and our email address to contact us. And I listed Ronisha's information here. Same phone number, same email address. If you're not a member of the Retirement Association, I highly suggest you become a member. It's a very good way to stay connected to your UC community. I've also listed Centers for Medicare and Medicaid Services, also known as CMS, Social Security, and HICAP. In conclusion, I want to just make sure I remind you to read your open enrollment booklet. Many of your questions can be answered by reading your booklet every single year. Review the pre-recorded presentations by visiting this link here. You want to make sure you confirm your changes and make sure you receive a confirmation. If you are satisfied with your current health plan options, you are not required to do anything, but it's highly suggested that you log in to view your current enrollments. Again, if you are satisfied with your current health plan options, you are not required to do anything. You do not need to call RAS. You do not need to call your healthcare facilitator. You do not need to call your benefits office. If you add any family member to your plan, make sure you expect a letter from Unify HR in or around the month of February. Unify HR will be requesting documentation to verify the eligibility of your new dependent. If you change plans, look for your new ID card in the mail and file your old card away just in case you need to refer back to it in the future. If you don't have your new ID card by January 1st, contact the plan directly. Again, open enrollment ends on Tuesday, November 19th at 5:00 p.m. Pacific Standard Time, and this is a new deadline. That completes the presentation. Thank you so much.